Hi there. Let's now go through some cognitive techniques within the cognitive therapy model. So with the cognitive techniques, it's all about theory building and weighing up the evidence that confirms or disconfirms a belief. But people with depression tend to have quite a negative cognitive bias, and they look for information that confirms their negative beliefs. For example, if a patient were to think, I'm incompetent, they might sit in an appraisal with their boss, and instead of hearing all the great things that the boss has said about them and the way that they're performing, they might just home in on that one thing that the boss said that they need to develop and improve on. Now, a cognitive therapist must help a patient to evaluate all of the evidence. We do this using thought diaries. Now, there are many available online and within Beck's book, but the main information that you need in any thought diary is the date and time for the patient to record, the situation, so a bit of contextual information, what was happening, where were you, what thought there was, what emotion there was, and an alternative, more balanced thought and an outcome. And then outside of this form, you may want to use an additional form that helps the patient really to get to the balanced thought. It might be a list of questions for them to ask themselves if they're doing it independently, or otherwise it's for you to kind of go through with the patient and help them question and weigh up all that evidence. Okay, so in order to get to that alternative thought, it's our job to help someone consider all the evidence kind of for and against the thought. Now, this isn't about helping a patient to think positively or overly optimistically. And I think this is a bit of a misconception about cognitive behavioural therapy that you may come across. But in fact, if you were to do that, that would make a patient probably feel unheard or feel even worse than what they do now. Besides, if we have an overly optimistic view about how things are going to go, it's likely that we're going to probably be disappointed when things don't go quite as well. So that's what I want to focus on here. What cognitive techniques do you help a patient to get to that alternative, more balanced thought? Before I do that, just a quick mention about patients' thoughts and emotions within that diary. It's really important to have both of those pieces of information. Now, when a patient comes to therapy with a thought diary, you might feel a little bit overwhelmed given all of their thoughts. They might have, 10 different thoughts in one situation. And a really good tip I can give you is about linking the thought to the emotion and helping them to think about their most intense emotion and which thought that links to. Because if you can find that, then that should give you an indication of the hot thought, the thought that led to the most intense negative emotion, and that's the one that usually you want to help the person manage. Okay, so how do we do this? How do we go from the negative thought to the alternative, more balanced thought without being overly optimistic? Burns, if you have a Google maybe, so Burns have 10 ways to untwist your thinking. And so I can take you through some of these today just to help you think about ways that you can help a patient to think conjure a more balanced thought. So the first one is that I'm going to talk to you about is sort of examining evidence and testing evidence. So a good way to do this is they've come up with their thought and you want to ask them what their reasons are for that conclusion. So what convinces you 100% that this thought is false? And then you want to search for the contrary evidence. So what facts make you less certain about your conclusion? And then you can move to the alternative explanation. So what is another way of looking at this other than what your conclusion is? And then you can derive your conclusion based on the facts and that plausible alternative explanation. The next thing is double standard method. So instead of putting yourself down in a harsh, condemning way, it might be supporting the patient to talk to themselves in the same way that they would talk to a friend with a similar problem. And I've had really good results with this. It's something I really like doing. And you know, if you're interested in compassion focused therapy, it's something that you'll probably really think about in much more depth. But really simple technique. You know, someone is having a thought about themselves, really quite a self-critical thought. So you could say, you know, would you say the same thing to a friend in a similar situation? Another good technique is, would you say the same thing to a child in a similar situation? Invariably, their answer is no, I would not say that about another person. And you say, why not? And what effect would it have on that person if you did speak to that person that way? This can be such a powerful technique, and often makes people realize that they really are their own worst enemy. They think about, they have such critical thoughts about themselves, and treat themselves much more badly than they would anyone else. So give that a go. The next one is the experimental technique. So you can just help the person to do an experiment to test the validity of their negative thought. So that might be, if I ask help from a teacher, then the teacher will ridicule me by shouting at me or say I'm stupid for not understanding. So the experiment you devise is, well, let's ask for help and gauge the response. Now, word of caution when doing this, remember that if we imagine there is any likelihood of this actually happening, then it's always good to consider, to help your patient to consider any negative automatic thoughts that they have about how they'll cope with this. And this is another element to test. So I hope that will help mitigate those problems. The final one I'm going to talk to you about is thinking in shades of grey. So instead of thinking about your problems in all or nothing extremes, it would be about evaluating things from a range of 0 to 100. So for example, helping a patient to consider that when things don't work out as well as what we'd hoped, to think about the experience even as a partial success rather than a complete failure. Well, actually, you still managed to go and ask that person for help. You still managed to take some learning from the experience based on what they said. Okay, so there's a couple of sort of examples from Burns's 10 ways to untwist your thinking. I'd really encourage you to kind of look into that, because I think you'll probably find some other techniques that you find really useful, and all of these can be used with your patient, because essentially they are all designed to really, I suppose, help your patient put things into perspective and consider alternative, more balanced views. Okay, I hope you've really enjoyed that. Thank you for listening, and I will see you again shortly.